Watson, nurse practitioner, coming to you today to clarify lab values. Disclaimer, this is not medical advice, recommendations, or diagnosis. This does not take the place of a well-child check or sick visit. If you have any questions, please see your healthcare provider. So if you've ever had labs drawn, or if your child has had labs drawn, you know that the provider usually calls you back with results. And you know that across many different healthcare platforms, those results are sent to your parent portal or to your patient portal, and you can review them. Sometimes there may be a red number, whether it's low or high, that is there, even though your provider says all labs are normal. And I just want to clarify, it is not that the provider has overlooked that or doesn't know what they're doing. There are ranges for every facility. Every facility's lab ranges are slightly different. They're not a huge difference, but they may vary, a tenth of a point, a whole point, or something. So what is normal for Navarre Regional here in Corsicana may not be normal for Dell Children's in Austin. And it's just the way it is. So we as providers, when we look at those lab values and we look at the results, we take the result and we look at what's going on with the patient, what that result is telling us, and if it's even relevant. If you are slightly lower on our results and it's not relevant to the situation, then it's probably not significant. If you are a tenth of a point high on something, it's not relevant. So and it really depends on what's going on, but sometimes you're going to see a red value come up on your labs and your provider is going to say all labs are normal, and you may be, questioning what they're saying or why they're telling you it's normal if it's red. So just note that every facility has a normal range, and that normal range differs between facilities, and depending on the particular patient and what's going on and how far off of that normal range it deems it significant or not. I hope this clarifies some. I hope you really trust your providers. Also, I'll just go ahead and kind of add this in there. If your labs look fine, there's nothing wrong, but you still feel off, keep exploring, keep pushing, keep fighting for yourself. If there's something going on, then you need to make the diary. You need to go make all of the charting for yourself so you can present it to your provider, because as a provider, we have certain things to go off of, and so we use those protocols. But I just want to clarify that for labs. So not always is it going to be perfect black and white numbers. Sometimes you're going to have some reds and your provider is going to say it's normal, and it really just depends on the patient and exactly how far off those numbers are. If you have any more questions, please feel free to reach out.